My name's Jessie. I'm a physical therapist down at Highlands Ranch, and today I'm going to talk to you about back pain and what you can do at home to help make yourself feel a little bit better. If your back starts to hurt, there's a couple things that you should do to help make yourself feel a little bit better. You definitely shouldn't be sitting still. You shouldn't be doing too much. Your back needs time to heal. You also need to keep moving a little bit to help stretch those muscles out, to help make it feel better, help the muscles relax, and tell your body that it's okay to start getting back to doing what you want to do. A lot of people wonder about whether to use heat or ice following a back injury, and typically the answer we give them is it depends. So if your back just started hurting all of a sudden, say you bent over and picked something up wrong, you want to use ice. Your back is inflamed, your muscles are angry, so you want to use the ice to help calm that down. If you have chronic back pain, meaning you've had it for a long time, usually heat is a good way to go. That'll help relax the muscles and help everything to loosen up and allow you to start doing a little bit of stretching and exercise to make it feel better. So as far as medication goes, as a physical therapist, I can't tell you to take something or not take something. If you're really concerned about if it's hurting really bad or you need something stronger than, say, Advil or Tylenol or something you could buy at a pharmacy, give your doctor a call. Anti-inflammatories such as Aleve and Advil will help decrease the inflammation. There's also medications that are more directed towards pain control that your doctor can help prescribe. Either your orthopedic or your primary care can do that. So now I'm going to demonstrate some exercises that'll help you at home with your low back pain. First and foremost, laying like this is not a good idea. It puts stress on your low back and it can pull on the nerves. So what I like to recommend for my patients to do is to bend both knees. This can be laying in bed. You can prop pillows up under your legs to help keep you comfortable. And if you decide to lay on your side, you can also prop one between your knees. In this position, when you're in bed, is a great time to practice some stretching. So what you can do, keeping your core nice and tight, you can pull one leg up to your chest, nice and gentle until you feel a stretch in the back of your hip or in your back. Obviously, we want to make sure you keep yourself nice and even, so do it both sides. Do not be concerned if one side moves more than the other, because if one side is tighter, that side's obviously not going to go as far up. Another stretch that you can do is for your hip. You can put one leg over the other, keeping this knee bent. Take one hand and push this knee out. You should feel this stretch in the outside of your hip. If you feel pinching in your groin or if you get pain down your leg, go ahead and stop. That's a little too much. If this is too easy and you don't feel this stretch, go ahead and grab behind this thigh and pull it towards your chest. Hold, and bring that leg down. Again, do it both sides. Other stretches that you can do that are good. You can cross one leg over the other, and you can gently pull this leg towards you. Now, if you have any pain into your leg, into your buttock, or anything like that, do not do this stretch. This is for your back muscles if you just have a gentle pull. And then you're going ahead and come back up. All of these stretches, you want to do anywhere between 3 to 5 repetitions, hold for about 20 to 30 seconds each time. Other muscles that are good to stretch would be your hamstrings. Again, if you have pain into your leg, you don't want to do this stretch. If you do not have pain, go ahead and take your leg, bend your knee, hold behind your thigh, and slowly kick your leg up until you feel a stretch in the back of your leg. You can pull your toe toward your nose if you don't feel the stretch enough, and bring it back down. This is also a great position to do a nerve glide. So for those of you that have irritated your disc potentially, doing a nerve glide will help calm that nerve down. Hold your leg up here, behind your thigh, keep this leg bent and your toe pointed down. Slowly bring your leg up, and as you do, point your toe. Only pull it to the point where you feel a gentle tension in the back of your leg, and then slowly bring it down. This is called nerve flossing. A lot of people with sciatica find a lot of benefit from this exercise. Bringing your leg back down, other things you want to do, you want to turn on your core muscles. You have deep muscles in your core that help to stabilize your back. A great way to do this, again, is in this position with your knees bent. Go ahead and keep your hands at your side, flatten your back into the table, and squeeze your glutes. This will help activate that core muscle and help stabilize your back. One of the really important things to consider when you have back pain is, how do I get up and down from a laying position? Again, you want to have your knees bent and your hips and shoulders all in a straight line. Your body is going to move like you have a rod down your back. This is called a log roll. You're going to roll to your left, keeping your shoulders and hips together. Use your arm to push yourself up and let your legs fall on down. Again, you can also go from this position once you sit down, lay back down onto your side, and then roll back to that position laying down. I always like to tell my patients, roll to the side that hurts less. So if your left side of your back hurts, go ahead and roll to your right, and vice versa. If you do these exercises for a couple weeks and nothing changes, that would be a good time to go check in with your doctor and see if further care is needed. If you're not feeling better after a couple weeks, we at Panorama are here to help you. We have physical therapists, doctors, trainers that are all here and work together as a team to make sure that you feel better soon. We have offices in Highlands Ranch, Golden, and Westminster, and look forward to seeing you.